Some time ago, the president was interested in expanding the scope of the offerings here at Wingate University, and it occurred to him that with the significant shortage of manpower in the pharmacy industry, that we would be a good place to have a school of pharmacy. So, to make a long story short, an effort was undertaken to do a needs assessment in the area, and it was really a no-brainer that we were ripe for having a pharmacy program in the greater Charlotte area. The response to our launch of the School of Pharmacy here at Wingate University has been almost overwhelming. This past year we had 1,112 applications for the 72 slots that we have.
I applied to many pharmacy schools and across the nation. I mean, we have people from Canada, we have people from California, very far away, that have come across the country for this school.
One of the chief differences between our program and other programs in pharmacy is the amount of clinical experience that we have here.
We implement practice experience early on. Even students who have never worked in a pharmacy before can come to Wingate, and their first semester of school they'll get some experience working either in a community or a hospital setting. We don't wait till the fourth year to throw the students out into a pharmacy for the first time.
I had never worked retail before, and it was really very interesting to be in a little southern corner drugstore.
And second year we have the same thing except in a hospital. So I've never worked in a hospital before. So I had that experience last semester. And next year I'll have an advanced hospital rotation. I like having the internships during the school year because you can learn in class and then physically go and apply the knowledge right there during the semester.
Then in the fourth year, all of the students pursue 45 weeks. That's 9 5-week rotations year-round.
So, which is basically working. Every 5 weeks we went to a different site and we had a different preceptor. We start in May where the other schools start in August. So we're already out there, we're already getting our name out before the other students even come by. So that's kind of good for us.
A lot of the professors are out in the hospitals and clinics rotating in the morning, and then they come back here and they give cases of like, oh, this is what happened today in my clinic or in my hospital.
So that really helps me learn, having the physical, practical aspect and then having the theory in class. So I think that's really good. And the school is small, our class is small, the professors are very accessible, their doors are always open. It's very casual. I mean, it's professional in the class, but at the same time, it's casual in the sense that you can always go talk to a professor. There's never, I'm in a meeting, I can't talk to you, or make an appointment. It's very casual, which makes it very easy to learn.
The student-faculty ratio is so small that you know your professors, they know who you are.
That is a huge benefit for somebody who's trying to get as much out of a program as they can, because they will always have that student-teacher bond, which is very important in a person's education.
This class that we're in this semester, Community Healthcare Outreach, is based on community service.
We're educating the population, we're getting out into the community, we're talking about disease risk factors. For example, some groups did diabetes in kids. We did women with heart disease, and it's a learning experience for both us and the community.
We have a dress code at Wingate, so we had to get used to dressing professionally. It definitely changed the tone of school compared to my undergrad lifestyle and my professional lifestyle.
I think it's a lot about, this is a doctorate program. This is a highly competitive school to get into, and the people here that get into here are very driven.
And we also have an honor code, which is really nice. So nothing ever gets stolen, everyone trusts everyone, and something that was instilled from the beginning. You get really personal with your class. I mean, I know students, I know who their spouse is, I know if they have kids or not, I know where they're from, I know about their families, It's a really nice environment. It's very conducive to your learning, and I think it's very important, especially in professional school, because this is what I'm going to be practicing.
For those students who have a special interest, and that's usually developed during their classroom instruction, it might be an interest in pediatrics, or it might be an interest in diabetic care, we give opportunities for those students to have special rotations at the end of their program. They will have 15 weeks of elective coursework in a clinical setting where they can really hone their skills and have some special credentials. It might be in veterinary pharmacy, it might be in Indian health services.
You know, it's a booming field, so you're always looking forward to, okay, what am I going to do next? What am I going to do when I'm done?
The profession is so vast, you can really have a niche. If I wanted to work for the federal government, I could. If I wanted to be a clinical pharmacist, I could. And also the education aspect. Pharmacists are also traditionally known as educators.
I think I'm going to try and come back to Wingate, hopefully, and teach maybe, you never know.
We were very pleased to learn that 8 of our graduates have been accepted into postgraduate experiences throughout the country. They will spend a year doing postgraduate studies, and then upon graduation, they'll either go into academia or into pharmacy practice.
If you like that small environment, if you like that, hands-on experience kind of thing, you don't want to be hidden in the shadows with 200-300 kids in your class, I definitely think it's something to check out.